Do you often feel like you need constant praise just to feel good about yourself? Or maybe you've noticed someone who brags a lot, can't handle criticism, and seems to care only about themselves. These behaviors might link to Narcissistic Personality Disorder, or NPD, a mental condition in Cluster B, where emotions and relationships are intense and unstable. People with NPD deeply want admiration, but often struggle with hidden self-doubt. Imagine someone who posts 10 selfies a day and gets upset if no one likes them. Could that be more than just vanity? It might be a cry for validation. NPD isn't just being full of yourself. It's a real struggle affecting how someone sees themselves and connects with others. What causes someone to develop NPD? It's not just about having strict parents or being spoiled as a child, though those can play a role. Think of it like planting a seed in poor soil. If a child grows up with too much praise for looks or success, you're the most talented kid ever. Or on the flip side, with constant criticism or neglect, you never do anything right, they might build a false self to survive emotionally. Some people are born with sensitive personalities, like being more easily hurt or needing extra reassurance. When that mixes with tough parenting or bullying, it can shape a pattern of seeking control and admiration. For example, a boy ignored by his busy parents may grow up striving to be the best, just to get a nod. It's not their fault, it's how they learn to cope. Have you ever known someone who dominates every conversation, turns your sad story into theirs, or gets furious when not the center of attention? That could be NPD. Signs include extreme need for praise, lack of empathy, why are you upset, I'm the one with problems, believing they're special or unique, fantasizing about unlimited success, and taking advantage of others. Imagine planning a birthday for a friend with NPD. They end up complaining their party last year wasn't good enough. Then take over the event to make it about them. They may seem confident but crumble if criticized. Even a small comment like maybe, where something else can feel like an attack. They're not being dramatic on purpose. Their self-worth is fragile beneath the pride. How do doctors diagnose NPD? Not by one test, but by talking. A therapist spends time, weeks, even, listening to your thoughts, relationships, and feelings. They don't use blood tests, they use deep questions. How do you feel when someone disagrees with you? Or, do you often feel misunderstood or underappreciated? To be diagnosed, someone must show at least 5 of 9 key traits from the official handbook, DSM-5, like needing admiration, feeling entitled, or lacking empathy. Treatment, it's tough because people with NPD often don't believe they're the problem. It's everyone else being jealous. But therapy like psychodynamic therapy helps. Example, a woman blames her failed relationships on losers not understanding her. In therapy, she slowly sees how her need to always win pushes people away. Medication doesn't cure NPD, but it can help with anxiety or depression that come with it. Can NPD be prevented? You can't vaccinate against it, but you can raise kids in a way that builds real confidence, not ego. Think balance, praise effort, not just results. Instead of saying you're the smartest, say I'm proud you kept trying. Let kids experience failure safely, like losing a game and learning it's okay. Open conversations about feelings help too. I saw you were mad when Jake didn't share. How did that feel? This builds empathy. For teens, constant validation through social media, look how many likes I got, can fuel NPD-like behavior. Parents and teachers can encourage humility and teamwork. Prevention isn't about perfection. It's about creating emotional safety so kids don't need to build a fake, superior self to feel worthy. Recent research shows we are understanding NPD deeper. Old view, narcissists are just arrogant. New view, many suffer silently with shame and fear of being exposed as inadequate. Studies using brain scans show people with NPD may have differences in areas linked to empathy and self-awareness. Another advance, a type called vulnerable narcissism. people who feel superior but are also easily hurt, shy, and anxious. They do not brag much, but secretly feel better than others. Treatments are evolving too. Schema therapy, which explores childhood roots, is showing promise. One recent trial found that group therapy focusing on self-compassion helped reduce narcissistic traits. Scientists now see NPD not as a character flaw, but as a